So if you're suffering with face pain, you've probably heard by now the term trigeminal neuralgia, but you may not have heard of trigeminal neuropathy. And it's just as prevalent and it's just as important from what we see in our office. And quite often the understanding of the two is not really clear, and sometimes that leads to mistreatment or even misdiagnosis with some patients. So if you're suffering with face pain, then I really want to talk to you because this is really, really important. And before we go any further, I want to also elaborate on that and just clarify that if at any time you're having face pain should never be ignored, especially if you're getting sensory change with it. This does require urgent assessment. There is a lot of different things that can actually contribute to face pain outside of trigeminal neuropathy or trigeminal neuralgia, and some of these can potentially have long-term consequences. So we want to make sure we get them checked out. If you don't know where to go, you don't know where to start, just send me a message. I'm always happy to help out and let you know whether or not you should be seeking things further or not. All right, so let's start talking about the trigeminal nerve before we get into the other stuff, and then I'll talk about things that you can do to also help your face pain as well. But the first thing I want to talk about is this thing called the trigeminal nerve. So this is the trigeminal nerve, a summary of part of the trigeminal nerve. So the trigeminal nerve actually comes out, branches into three, hence the term tri as part of that trigeminal. The first aspect of it heads up and basically supplies the entire area of your front of your head. The second part is your maxilla branch, which heads forward and supplies that whole area in the middle of your head. And the third one goes down and supplies that whole bottom jaw area. So these are the three key areas for our trigeminal nerve. It's also responsible for providing the nerve supply to your muscles around the jaw itself, and also allowing you to bite down, more importantly, rather than open your mouth, and to allow you to chew too. If we follow this back, and we're going off the picture here, but we follow it back, it actually comes down into your brainstem, where it integrates with your flight or fight centers in an area called your midbrain or your mesencephalon. And this is the area that is responsible for your self-defense. So in other words, your sympathetic outflow comes from this area. Then it heads up from that area there and supplies all the blood vessels of your brain, and also supplies all the coverings around the brain as well. So it is a really, really diverse, wandering type nerve that just goes everywhere from here up, including the neck as well. It takes input from. So it's a key nerve that's responsible for winding us up into a flight or fight response. It affects our arousal rates, can affect our sleep at night, and it's also a very, very, very key part, a pivotal part of those people who get migraines and headaches. All right, so how in the world does this go from this to this pain pattern, which is really important? All right, so let's break up trigeminal neuropathy versus trigeminal neuralgia to begin with. So trigeminal neuralgia is a very, very clear condition. So trigeminal neuralgia is basically when we're getting irritation to the nerve, which can be either of these things. They're both irritation, but trigeminal neuralgia really is talking about irritation. And when we're talking about this irritation, in the trigeminal neuralgia's cases, we're usually talking about sharp shooting electric shock type feeling going into the face. So it's the kind of thing that just catches you, and it's a sharp shock that goes into the face that just comes randomly and out of the blue. And this trigeminal neuralgia is basically this nerve that's firing off, sending signals into the brain. And there's a lot of different causes for that. Generally though, what we're talking about is irritation to the nerves. They can come from blood vessels that are sitting the wrong way, from trauma, all kinds of different things, and we'll get into them in a little bit more detail. When we're talking about trigeminal neuropathy, now we're talking about chronic kind of injury to the nerve. So it's a little bit different. We're talking about neuropathy. This is usually something that comes about because the nerve's been directly damaged. So it's something that often happens when you have teeth pulled or things like that, where the nerve gets irritated and now keeps signaling to the brain that there's something wrong, even though there isn't. And this tends to cause, rather than this electric shock type pain, tends to cause this gradual chronic kind of facial pain that just keeps going on and on and on. So the key markers for both of these, whether it's neuralgia or neuropathy, is face pain. So this is the big one. We need to understand that no matter what we're talking about, when we're talking about trigeminal nerve damage, we generally are talking about face pain. It could be anywhere along the head or the front of the face, but that's what we're really referring to. Other key thing with this is quite often we'll get temporarymandibular disorder, so jaw problems with this. And this is a really, really important thing to understand. If we can see, this is your jaw coming through here. I'll just change my colors here. I might go to something a bit more visible. So this is our jaw coming through here. This is the joint that sits here for the jaw itself. You can see how close it is to the trigeminal nerve. In fact, the trigeminal nerve, it's not really clear here, but the trigeminal nerve itself actually sits back underneath and behind the joint in this little space here, where it gathers its information from about jaw movement and sends it back up into the nerve itself. So when we start having problems with jaw movement in any way, shape or form, problems in jaw movement quite often result in issues with the trigeminal nerve, whether you're suffering from migraines, whether you're suffering from headaches, neck problems or anything else. So temporarymandibular disorders are a common marker of trigeminal neuralgia and neuropathy. Tooth pain. Tooth pain is a more common thing associated with neuropathy as opposed to neuralgia. And what we end up having is this chronic pain that sits inside our teeth. So it sits kind of, this tooth might be sore here today, and you'll often mistake it. Have I got a hole in my tooth? Have I got an abscess? Sometimes it's quite misunderstood as to what the problem is with it. And interestingly, it'll tend to move around. So what might happen is you go to the dentist today, they check the tooth and go, no, you know what, I can't find anything wrong with the tooth, there's nothing there. And then you wake up the next day and now the pain is in this tooth, and then you wake up the next day and it's back to this tooth, the next day it's in this area here. And what you're really seeing is irritation to these nerves in this area, sending signals back to the brain that the brain misinterprets as coming from the tooth. So it's not actually a tooth problem as such, it's actually a referred issue coming from the nerve itself. And often what we've often seen here in the past is people end up getting the tooth pulled because the pain is so significantly overwhelming all the time. So they'll pull the tooth to try and get some freedom, but the result of pulling the tooth is that the pain just moves somewhere else, and now we have more damage to the nerve, which can sometimes complicate the problem even further. Okay, so the next lot of stuff we're coming from there is we start talking about neck pain. The main reason, or stiffness as well, and the main reason for that is this nerve actually heads down and has influence over our neck muscles as well. So some people will get pain, some people will just get stiffness where the neck always feels tight, like they just need to free it up and rub it all the time. And that'll sometimes come about just because the mechanism gets wound up. And same as our visual and hearing issues. So part of this midbrain, or this mesencephalon, is input coming from your eyes and input coming from your ears. When you have input coming from both your eyes and ears into that area, it again winds the mechanism up. And as it winds the mechanism up, it's like the microphone gets turned up. So these people often have chronic pain issues all over the place. They often have light sensitivity and they often have sound sensitivity as well as part of their problem. And in some issues, in some circumstances, people may even get an increase in the sense of smell. Like they start noticing that people have eaten pasta this morning and it's now 5 o'clock in the afternoon. I mean, a really sensitive smell. They start smelling everything, which can make them a little bit obsessive about things at times. And of course, on top of all this, there's a massive psychological overlay that goes over it. And some people have mistakenly said that your pain is because you're anxious, when often the case, the excessive stimulation to our brain from this area results in the brain getting wound up, and this produces a psychological overlay with these conditions. And then not to mention the fact that just chronic pain creates psychological problems for people as well. So what can we do about this? How can we start trying to turn the tide on this? So the few key things. The first one, which is the most important thing, is you need to rest. Now, I'm not necessarily talking about you needing to rest as in don't do any exercise or anything like that. I'm talking about you need to rest your face. So we need to bring the input down. Don't leave your mouth open for long periods of time. Don't spend hours and hours at a dentist having your mouth open, getting cleaning and all this work done. Any irritation to that nerve itself can create problems. Likewise, bring the sensitivity levels down, bring the lighting down a little bit, bring the noise levels down a little bit, and let your brain have a chance to settle and heal down. The TMJ, we need to deal with the TMJ. So we need to make sure movement of the jaw is proper. And TMJ diagnosis and assessments are actually quite difficult, and there's not too many people that are properly trained in how to actually assess a jaw. It's not about measure of feeling movement necessarily. There's a lot of complicated aspects to dealing with the TMJ that some people are well trained in, some people aren't very well trained in. So make sure you find yourself someone who's properly trained in dealing with the TMJ. If you don't know anyone or can't find anyone, just send me a message and I'll see if I can find someone for you in that area. Otherwise, my team are expertly trained in this field as well. Emotional stuff, as we spoke about before, we need to calm the brain down. We need to get under control emotionally. So there's a ton of different things we can calm people down emotionally and get things under control. There's different hormonal support, things like progesterone or testosterone, depending on female or male. Support often helps people with anxiety. Certain herbals such as rhodiola can have a big influence on those type of things. And when we're moving on from that, calming that down, now we're talking about calming the nerves directly down. And there's some good research now on things like PEA, which have had some improvement in people. It can take a couple of months for it to properly kick in, but it does reduce that down somewhat and help calm this down. Anything that supports GABA, so the drug gabapentin is sometimes used for these type of things as well. So things like magnolia that help Gabia up can sometimes help with these issues. Sometimes even avoiding specific foods and getting inflammation down can have a huge effect on trying to calm these things down. Serotonin as well. Serotonin support often has a big support, big help with this, just because again the serotonin is used at the spinal cord level to help block pain from getting through. So there's a lot of different things that can be done to deal with this type of problem. It's not just a matter of you suffering with it and trying to deal with it on your own. But we need to understand first whether you're having trigeminal neuralgia or trigeminal neuropathy, because understanding which condition you have will completely change potentially how you should be managed. Anyway guys, that's a quick look into trigeminal neuralgia and trigeminal neuropathy. If you have any questions at all, just post them up. If you're suffering one of those things and you want to know a bit more information about it, post it up, or otherwise feel free to send me a message. I'm always here to help you in any way, shape or form. My team's here for you as well. You're never alone. Anyway guys, that's it for me for now. I'm Trev from Spinewise. If you have any other questions, send me a message, post them up, and I'll catch up in the next vid. Bye for now.